In my opinion, fat grafting is one of the most powerful things that we can do in breast reconstruction to make a really meaningful difference in a somewhat small surgery. But fat grafting is often confused with body-based surgeries, so let's explain the difference. When we're discussing fat grafting is when we do liposuction of one area of the body, typically abdomen, thighs, or back. We take that fat out, we process it to get rid of extra oil or blood or fluid, and we take this beautiful purified fat and we inject it into the area of reconstruction. This can be done for both implant-based and flap-based reconstruction. If it's flap-based reconstruction, fat grafting can be used to increase the size or fill out little contour abnormalities. In implant-based reconstruction, it can be used to increase upper pole fullness, which is one way that I like to use it, or just increase the thickness of the mastectomy flaps. It's done typically as an outpatient procedure or can be done in combination with other parts of a flap revision surgery. So I think that it really can make meaningful changes in patients as part of their breast revision reconstruction. Now, why wouldn't you want to have this surgery? Well, it is liposuction, which can be a little bit uncomfortable for certain people. It's adding a second donor site. Not all patients have excess fat on their body that can be harvested. This is not a large volume liposuction. You really only need a little bit, but still, some patients just don't have enough. But the other thing that your plastic surgeon really should discuss with you is the idea of fat necrosis, meaning fat death. When we suck the fat out of your body, it is non-viable. It is just fat sitting in this little container. When we inject it back into your body, it has to reestablish a blood flow. We do this by carefully infiltrating the fat in small little ribbons close to blood supplies. But studies show that only about 60 to 80% of the fat we inject lives. So what does this mean? That means that 20 to 40% doesn't live, it dies, and it undergoes necrosis. If it's a small little ribbon, your body can just reabsorb it. But sometimes if it's a larger area or it's just an area your body can't get to resorb, it just stays. And it results in these little palpable lesions that almost feel like pebbles. That can be very scary to a woman with a history of breast cancer, especially if she palpated her lesion. So I rely on the literature, and studies show that if you have fat grafting, you do have about a 5% increased risk of needing a biopsy in the future. And for some women, that is not worth it. They don't want that fear. But it's very important to discuss that with your surgeon. If you've had fat grafting, let me know your thoughts below. Did you think it was worth it? How was the recovery?